Live from Studio 2A in PIX Plaza, this is the PIX11 Morning News with Sukanya Krishnan and Corey Chambers.
Well, nearly 70% of Americans are on at least one prescription drug, and more than half receive at least 2 prescriptions. In New York alone, of course, there's more than 250 million prescriptions. They were filled in 2014. That's a lot.
Yeah, there's a lot you need to know, though, before you head to a pharmacy and take that prescription pill. Dr. Linda Bernstein is joining us now to tell us what all of us need to be asking. So good morning to you.
Good morning. Thanks for having me.
Yeah, we're happy to have you here. And the first question involves, should you take your medication on an empty stomach? Why is that such a big deal?
Some medicines work better on an empty stomach, and some it doesn't matter. So that's one of the important questions you should ask your pharmacist about your medicines.
Now, what about on the flip side, too? Like, are there any activities that you should not be doing while taking your medicine, or
Absolutely.
foods to avoid?
It's important to ask, well, there's actually 5 questions to ask about your medicines, and I can just run them through very quickly for you. First of all, the name and the purpose of the medicine.
Okay.
That's important to know. Secondly, know how to take the medicine and for how long, and when will it start to take effect. Thirdly, that's where you come into that question of the precautions. Are there any foods, drugs, activities, other beverages to avoid? And finally, side effects. What are the important ones? What should I do if they occur?
Of course.
And then ask about savings. There's the possibility that you might be able to save some extra money on your medicines.
Yeah, talk about the generics, because, you know, I think I do have questions about that. I know it's not the exact same thing. It's the same active ingredient, but are there some generics that don't quite work as well, or typically they work just as well?
That's an exception to the rule. Most generics are equivalent to the brand name product. There are only a couple of cases where you wouldn't want to do that substitution. Ask your pharmacist if you can use a generic, and that's just one of the number of ways that you can save money on your prescriptions.
Yeah.
You can also make sure that you stick with one pharmacy, but on the other hand, you can shop around to see if there are any pharmacies in the area that have a less expensive product.
And sometimes even like if you have a health insurance company, you'll be able to mail order and get a cheaper price if you do a larger quantity.
That's one way. And FamilyWize.org has a great price drug lookup tool, so you can look up the price of your medicine that's in the pharmacy in your area. We also have a prescription savings card, and those 2 things can definitely help get you perhaps savings that you're looking for.
Yeah, because medication can be very expensive. Very
Absolutely.
expensive. Now, define this one for medication adherence. What exactly is that?
That means sticking to the program, following the directions, and that's one of the most important ways that you can be a wise medication consumer. So if you know your medicine well and are proactive about it, make sure that you don't just take it willy-nilly. You know, there's very little room for error when it comes to taking medication. So you should comply, stick with the medication regimen that's been set up for you by your physician.
Yeah, Dr. Linda Bernstein, thanks so much for coming in. Some important questions we're certainly going to ask next time we head to the pharmacy. We appreciate that. And by the way, we should mention, October is Talk About Your Medicines Month, and we're going to have much more on what you need to know. Check out the PIX11 app and click on the Morning tab.